watching My Baby Experts, and we are back with you again tonight for another special episode. My name is Shari Criso, and I'm the host of your show. And tonight we have a really amazing show planned for you. As you can see, for all you guys who've been watching for a long time, our format is a little different tonight. We're testing out something new. How exciting, right? You know, all the times that we've done this show where I've had these great guests. And, you know, you hear their voices in the background, but you don't actually get to see who they are in person. Tonight, we tried something a little different so that I could really introduce you to somebody that I recently met who I totally fell in love with. And this is Dr. Ching Chen, and she's joining us tonight. Welcome to the show, Dr. Ching.
Hi,
Hi.
thank you. It's my pleasure.
We're so happy to have you, and you're so beautiful. We needed to have you in full living color tonight. So here's the thing. Let me explain a little bit about my background, and then I'm going to have Dr. Ching explain her background so that you understand who you're listening to tonight. I am a certified nurse midwife. I was also a registered nurse, a labor and delivery nurse, and in my practice as a midwife, I delivered over 600 babies.
Wow.
For the past 10 years, I've been a board certified lactation consultant, a parenting educator, and a retail specialist, a product specialist on everything out there having to do with mother and baby. And we've been doing this amazing show for the past almost 20 months now, 19, 20 months.
Wow.
Never missing a week. And for our loyal fans who've been there from the beginning, they know we come to them every single week with incredible topics, great guests, and the best information in the most non-judgmental way so they can really make the best, most informed choices for themselves and for their families. And so nothing has changed, and it has just gotten better, and our guests just keep getting better. So welcome. And let's talk about first of all what tonight's episode is going to be. Tonight we're going to talk about all those minor normal discomforts of pregnancy and postpartum that never feel minor. I mean, they talk about them like they're minor, but when they're happening to you, they don't feel so minor. And so Dr. Ching decided to come on with us to give us another perspective on what can we do to alleviate some of these very common discomforts that so many moms face while they're pregnant and then even after the baby comes. So Dr. Ching, let's start with just for a moment, because you're an osteopathic physician, and for a lot of people, they don't know what that is or what that means. Could you go into just a little bit of a description of tell us a little bit of your background and what it means to everybody?
Sure. Well, an osteopathic physician in the U.S., and yeah, this is it's very specific to the U.S., is actually another medical degree. It's a full-blown medical degree. It's actually the MD degree that you normally see, which denotes medical doctor. And it gives us, 4 years of medical schooling, just like the MDs, except we get to look at you with a different philosophy. And that different philosophy is I get to look at you as a whole person rather than you at bits and pieces at a time. Okay. So, what also is special about osteopathic medicine is that they teach us osteopathic manipulation, and we usually like to have contact with our patients rather than just, stand afar and touch and see where things are wrong so we can help you, adjust things back in place, for instance, and give you little techniques and exercises to help you, help yourself.
Gotcha.
That's the most basic aspect of it. And I think we use that a lot more those of us that use osteopathic manipulation use that a lot more than just say, okay, well, take an aspirin, take, whatever ibuprofen and call me in the morning. Because usually that doesn't work, because what's out of place is going to still be out of place, right?
And so you're just kind of putting a Band-Aid on it. And in a lot of cases, when you're pregnant, you can't even use the Band-Aid. So you're just basically suffering through it.
Right. So actually this is why osteopathic medicine is so great for pregnancy and even post-pregnancy. Because if you're breastfeeding, for instance, right, and you don't want, all the different medicines to get to the baby, right, causing other problems, or defects, right, or side effects, you get to minimize that.
Yes.
Right?
Yes.
And I find that to be really, really great.
Yeah. So you've taken care of a lot of moms and babies through your practice?
I'm starting to, and my friends really encouraged me to, and a lot of the practice and why I put up the website that I shared with you was because my friends were asking me so much questions and during pregnancy, and I said, wait a minute, how come you don't ask your OB?
Right.
I said,
They
well,
don't
my OB
know.
it's okay. So I said, and I kind of gave this really odd look, and I was like, I don't think it's okay.
Yeah. Yeah.
And they didn't have. They said, well, that's normal, and for me, that's not normal. So I decided to, like you did, right?
Yes.
Expand upon that and educate my friends and help patients now, and it's really great. And I think all this research is really great because I don't have kids yet, and it'll just make my pregnancy so much easier.
Oh, you're gonna have a one up on all of it. That's for sure. It's fantastic. No, and what you're saying just makes so much sense. It's there, especially in this country, we have become so medical in the way that we approach pregnancy, and as a midwife, of course, that speaks very true to my heart about, using alternative methods, using alternative ways and modalities to treat those discomforts of pregnancy, where if you go to your OB many times, what you're going to be told is, well, that pain that you're experiencing in your back, well, there's not much you can do. Just kind of, take a Tylenol, which is not going to help, and then and then suffer through it. And so many people, unfortunately, don't really enjoy their pregnancies because they're suffering from these common discomforts that go along a lot of times with pregnancy unnecessarily, because
Right, absolutely.
they don't know what could they actually do about it. And some of these things are pretty simple. Some of them are a little bit more involved. And I know in your practice, it's beyond just the manipulation. You're actually doing some acupressure, acupuncture, correct?
Yeah, I'm doing acupuncture, and I actually give you acupressure exercises to take home with you. So, because I'm big on educating people to take care of themselves. The most important thing is the other training that I have. I'm a specialist in physical medicine and rehab.
Okay.
What that basically means, that specialty in particular directs physical therapy, occupational therapy, speech therapy, neuropsychology, and stuff like that to help people with even, traumatic brain injury. But if you talk about pregnancy, back pain, or other pains in general, we get to help you, using therapy, different exercises, different optimization of like even things that you use, or just little reminders, like for most women, for instance, right? It's been as simple as, okay, we need to get a bra that fits for pregnant women. And even
You
for
are speaking to the right person because I am the bra queen.
and finding the right bra, for your pregnancy, pre-pregnancy, post-pregnancy is so important.
Yes.
And even, for regular women, I've seen people with have shoulder and neck problems
Yes.
that are just beyond. And all I had to do was lift up their strap and tighten it, or use one of those, those little,
Yeah.
what are those
Safety
little gadgets, right? To
Yes.
put on to make it erase your back, right? And then all of a sudden they're like, oh, it's gone. I was like, yeah, okay. That's how simple it is. So,
That's such a good point. Your breasts get so much heavier during pregnancy, and so that extra weight, not only on the breast, but then the extra weight on the belly, everything's pulling forward. Of course, you're going to experience either upper back pain, shoulder pain, lower back pain. A lot of it has to do with alignment and the extra weight trying to balance yourself.
absolutely. So,
Yeah.
I mean, like I tell people, well, your breast is going to definitely get heavier and more engorged. And in that time, what's the best type of bra is to get a good sports bra. You can buy a bunch of really good sports bras. And what women forget is it's just being able to scoop and lift, right?
Yeah.
Into place. The girls are supposed to be up here, not down here.
Exactly.
And it's so important, and that'll solve so many problems for you. And once you lift this, the belly will come up, the back will relax,
Yep.
and it's so huge.
It's
And it's so simple to do.
we have
Because what happens is, what we get is very much a imbalance of the
yeah.
muscles and anterior and posterior, right?
Yeah.
Which is the front and the back. And the rhomboids get really weak, and so your shoulders and upper back muscles really hurt. And then your neck starts hurting because it goes forward, right? And you get the increased curve in your back. And so you get headaches from that. And if you ask me, one of the biggest reasons like for people having headaches is because number one, it could be just from the breasts hanging too low, right?
Yep.
You're low in magnesium, and then you get that nausea and vomiting feeling because,
Mm.
what exits out of here at the bottom of your skull, right? We call it the big hole, the foramen magnum, right?
Yes.
And we have our vagal nerves and also, nerves that go to feed, right?
Yes.
Coming down. So of the muscles in the back of the head,
Mm.
right at the bottom, they're too tight, you're going to have like this radiating pain over here and sometimes over here. And then not only that, you're going to have more nausea and vomiting and you can't eat.
Mm.
So that's a really big thing.
Yeah.
And then what's going to happen is, and I think probably a lot of viewers ask you this, well, my arms hurt too. Well, there's some acupressure points in your arm because the way this is
Mm.
curved too much. So when it tenses up, it actually tenses up your arm. So what you want to do is actually go 2 to 3 fingers above here, right, on this side.
Yes.
And can you see that?
Yes, we
So
can. Perfect.
so you want to just press on that and press up. And if you see that it's really tight, you just push down here.
Yeah.
And these are vomiting points, nausea vomiting points that you could use to treat yourself. And what it does is actually goes back and reflex and decrease the neck muscle stimulation to stop spazzing.
So show that to us again. This would be for nausea and vomiting, and it's an acupressure point.
Right. So it's not you don't measure it, and how you measure it is everybody's different. So you use your fingers, right? You use
Yes.
your own fingers.
Yes.
And you go from here, you find the little bone here, right? At the crease, or you find your crease, right? You
Yes.
can see that.
Yep.
So you just like 3 fingers on there in the middle, and then you just press.
Right.
Right? And for most people, actually, because, we use the computer, we use a lot of things, right, with our hands, and it'll be tight. And you could treat it on both sides.
And a lot of people during pregnancy and during postpartum time too, they have carpal tunnel issues. And
Yes, and that'll help release it as well.
yeah, because the numbness. I know my hand was completely numb with my first baby from like 4 months on. My fingers, my hand, my right hand was completely numb. Yeah.
Yeah, so that's totally because everything's so tight, and if it's tight from here and it's like on fire up there, and because what also happened is sometimes, well, when some people are pregnant, or even when they're not even pregnant, even normal people, they sleep on pillows that are too high. The curve is too high. They're using the wrong side of it to
Yes.
sleep on the back, right?
Yes.
And so they end up feeling like this at night.
Oh, okay.
Okay, so if your shoulders are like this and your neck's like this, it doesn't get to relax.
Right.
So, and if you're carrying like a big handbag and you're like this all the time, it's
Yeah.
gonna give you more problems. And it's just like everyday, posturing and stuff. For instance, like everyday habits, like the trend of heavy handbags, for instance, right?
Yeah.
Or even afterwards, heavy diaper bags.
Yeah, or
Heavy diaper bag.
heavy child sitting on your hip.
Oh, well, that causes another problem.
Yeah, yeah, and the tilting and the neck issues, or breastfeeding in positions that are like hunched over and not doing it, you're sitting
Absolutely.
up. All those things,
Yeah.
you really need to be using good body alignment. One of the things that I noticed that really helps a lot with that backache issue, especially lower backache, and that round ligament pain, and that pain, what I'm
Mhm.
talking about are the ligaments. There's two ligaments that are attached to the uterus, and as the uterus grows, those ligaments stretch, and you'll feel that, especially during the second trimester, quite often as the uterus is growing, the ligaments are stretching, and it causes that pain that, the one where you go from like laying down to sitting, or from sitting to standing, and you feel like this can't be normal. That extreme sharp pain you feel, that's a round ligament pain. And so much of the time, what can really help that is even wearing a support garment, like a maternity support belt, to lift
Oh
the
yeah,
belly.
those
Mhm.
the you're talking about the little bands like the Bella belt. Actually, in practice, what your OB should be doing is providing you with like a SI joint belt. Um,
And so, what's the
that
difference? Explain to everybody what the SI joint is versus like what you're talking about here.
Well, it's pretty much this. It's pretty much the same. I think, like the one of the you don't mind brand names or anything, right? Like one of them are like Bella belts. I think the Bella
Yeah.
brand. of like elastic to hold help you with the belly. You know, it just gives you like a little more muscular support.
Yeah.
Okay. And the other one, the SI joint belt, it's you know how the ankle braces are, the elastic ankle braces, right? It's a little stronger,
Yeah.
right? And it's Velcro, so it's more adjustable.
Yeah.
But I don't find that it's as comfortable
Yes.
as you know, the nice Bella belts, right? Because they're
There's
usually
actually
hosiery made
there's
from
actually a, there's actually a brand that we really like, and it works really well because you want something that's actually going to lift, and it's called a baby belly band.
uh-huh.
The baby belly band is not so much more it's not so much of a band that helps to keep your pants open, but something
Hmm.
that actually goes on to lift the belly in a very
Hmm.
soft way, like it's all felt like a felt feeling, but it goes
Uh-huh.
on really nice. It's really comfortable and it supports the back because remember, it's just like it's like not wearing a bra. Okay, if your belly's getting big and you're not supporting it, if you find yourself walking around, okay, holding your belly up all day, that's a good sign that you probably need to get something to hold your belly up, all right? You see all those pregnant women walking around, you know who you are, right? Walking around holding your belly all day because you feel like it's about to fall out.
Yeah. Well, you know what it is. What they people need to do is those mommies need to do is also back strengthening, stretching and strengthening, which is so important.
Yes.
Because if your back is super tight, there's no room for the belly, so the belly can't go back in.
Mm,
Okay,
yes.
that's number one. And number two, you need to strengthen those lower belly muscles. Not you know it'll help you. After you know during your pregnancy and you know while you give birth as well to help push right
Yeah.
but so it's some very simple exercises
So
you
you
can
think
do.
like yoga would be helpful?
Yeah, yoga would be helpful and actually you know what's actually really helpful the really old little gadget Suzanne Summers,
Uh-huh.
the thigh
The
master.
thigh master? Okay.
Absolutely, you lean back,
Can you tell I
just
have one of everything in my
give
house?
those a few squeeze at night, you know, and it'll relax things and make things a lot better. The other thing that's really helpful and that's very close to it, because is if you've bought like ladies that have bought like those little Windsor Pilates little circle, right?
Yeah.
You could put it in between. It's the same thing, or something really simple like the band, basically the tubing bands, the rubber tubing bands. You just tie it around your leg
Yeah.
and double it up. If you start by just really light and then double it up and strengthen it.
Yeah.
Once you stretch those outsides, the inside will you know relax, the low back will relax, and then
Yeah.
you know just do that for a few times. You know,
Yeah.
you only need 5 minutes actually just to relax things
One
and
of the
make it stronger.
one of the things that really helped me because I was having lower back pain, and this was after the pregnancy, was that I was recommended to put some pillows under my knees when I sleep.
Uh-huh.
You know, like kind of bending my knees up actually took
Yep.
some pain off the lower back.
Yep.
And I think that's a really good idea, especially when you're pregnant. You know, one of the things you just want to watch out for when you're postpartum, and I want to just make a note of that, you know, that you don't want to really do too much elevation of the legs because you could be at risk for a blood clot for doing that. So we don't want to put too much under the knees postpartum, but during pregnancy, that would be something that you could try.
Well, I think postpartum, if depending on how much swelling you have during pregnancy, I really am a supporter of using compression stockings
Hmm.
during.
Yeah.
Okay.
Yeah.
Number one, it really helps to decrease the amount of like sciatica pain and other nerve pains that you'll have.
Yeah.
Okay, from the swelling.
Yeah.
But if you are swelling, number one, it's like first of all, it might be that your baby's getting really heavy, right? Your back's too tight, number two, right? And also what's happening is that you're probably not eating enough protein.
Mm.
So that's really important, okay?
Or drinking
Um,
enough water.
and drinking enough water,
Mm.
so important, okay? So those are some really basic things that you can do that'll help your pregnancy go so much better.
Yeah.
And then, you know, the thing with like swollen legs is that, you know, it really breaks down the tissue, right? In your skin itself. So later on, it's harder to recover from that, and that's why, if you have a lot of swelling in your legs, you tend to have venous insufficiency after that. So your veins have like gone bad, and you have all these really veiny, knotty stuff show up later on because the collagen is just not as strong to just hold up all the swelling and the compression and the irritation that goes on.
What would you
So,
recommend to somebody who's pregnant for the first time to like, because we always love to prevent versus treat, right? So
oh, absolutely.
first. So, like, what would be some of the ways that we could prevent that swelling beyond? I mean, one of the things that I know is one of the most common reasons is dehydration too. Is you would think that with all that swelling that you must be getting enough fluid. It's the opposite. Typically,
Hmm.
when you're not getting enough fluids, you'll be swollen. And another note too is that if you're noticing a lot of swelling in pregnancy, you definitely want to go check with your physician or your midwife because it could also be a sign of a more serious complication. Once they rule out that your blood pressure is fine, everything else is normal, now we consider it normal swelling of pregnancy and we get into, what do we
Yeah,
do
because
next?
absolutely, because if your blood pressure is too high, it could affect your kidneys, of course, and because there's so much pressure in that area, right?
Yes,
You're, you know, you could have a urinary tract infection that you might not know of that could backwash, right, up to
yes,
the kidneys. That might be bad for it. That's causing increasing your swelling as well. Or it might have like a blood pressure issue that's affecting your kidneys that's causing more swelling. So it's always good to follow up with your physician, right, on a regular basis and be good with that.
yes.
So that's really important.
Dr.
I
Ching,
think
Dr. Ching is in New York City, by the way, so you hear the sirens going off in the background, right?
lots of emergencies going on.
It's not her. She's got it. So don't worry, anybody. Go ahead. I'm sorry. I just had to say that.
But yeah, those are definitely basic things to look for, and I think right now a lot of the compression stockings out there, I know they're not too attractive, so to speak. So that might be a problem for women. But I think right now there's these even the athletic socks have new
Impression. Yeah.
compression type, and that will really help a lot. There's one that's really cute for ladies. I know you'll like it. That's up to knee level. That it's called Go Go, and it's very affordable, and it's kind of you could wear it to work as trouser socks even, and for athletics as well, and it'll just give you that extra oomph.
Yeah.
So I've just seen too many women go from like regular cute feet to like Flintstone feet, and it's just not good.
Yeah, yeah. No, I mean, when I was a nurse years ago, I was standing on my feet all the time in a nursing school back then. They used to teach us to wear compression stockings from being on our feet. And,
Hmm.
I've gotten used to that, even being in, what being on my feet a lot. Lots of times when I know I'm going to be on my feet for long periods of time, I'll wear compression stockings just to keep my legs from aching or swelling,
Yeah,
and
absolutely.
I feel better. I just always feel better when I do. So, it's sometimes difficult going into the summer months. It's hot. You're like, oh yeah,
Yeah.
the last thing I want to do. But if you're really struggling with swelling or varicose veins or spider veins, all those things, it's going to really help to help the blood circulate back up and to keep
Mhm.
some of that fluid from entering the extracellular space to cause that swelling.
Well, also the thing is like it reminds us to keep active because that's one of the ways, the major ways that you decrease swelling because you moving the muscle and contracting the muscle returns the extra fluid
Yeah,
that was out back upwards.
yeah, yeah.
And so, with that and the belt for the SI joint, and for your belly, so important, and that'll help it as well as you start and or continue to strengthen
Awesome.
your body.
Awesome. Let's do some viewer questions, okay? Because everybody here in the chat room, okay, they love to have their questions answered, and
Okay,
we
absolutely.
got some really great questions that came in tonight. So I'd love to
Hmm.
answer some of them, okay? We've got a
Okay,
question. This question came from Amber from Texas. And Amber
okay.
said, "What are some of the safe ways to relieve constipation when I'm pregnant?" And that's a really big issue for a lot of people, not only during pregnancy but after.
Oh, well, pregnancy constipation. A lot of times, what I find that's really helpful and what most women are missing is enough magnesium to balance off like all the iron and the calcium that you're taking. All of those two, right, tend to constipate.
Yes.
Well, and usually the formulation of iron, it's really like irritating to the stomach as well, and it constipates. So a lot of times you just need to balance it and take a chelated form. I like that form better of magnesium. That way you absorb it better, right? And take less of it. Or you can take most things that actually help you go, as you know, magnesia, mag citrate, even at the hospital, right? These are all magnesium based. And so, other than high fiber foods that are rich in magnesium and potassium, which will help you with the cramping as well, right? And relaxing your muscles, that's the thing. What also relaxes the involuntary muscles, which are your intestinal
Yeah.
muscles and
Yeah.
your GI tract as well, and making things easier. And not only that, magnesium will help you sleep better as well,
Yeah.
and it'll calm your baby down as well.
Those are all
Yeah,
good things. Oh,
those are all good things.
oh, and one more thing. More water.
Yeah.
More water.
Oh, more water. Oh my God. Yeah, you totally need to have more water to go in and lubricate it, of course.
Let me say something about the water because Dr. Chang, it's something that as a midwife, I think that I never stop talking about because it is really like, one of the simplest, healthiest,
Mhm.
easiest ways to alleviate so many of the things that we're talking about right now. Your body has an incredible need and demand for water when you're pregnant. Your blood volume is increasing by 50% somewhere around the 28th week of pregnancy, and because of that your need for the extra fluids increases dramatically, and your body will give you signals in the form of headaches. Your body will give you the signals in the form of constipation, back pain, like you said, urinary tract infections, even cramping, but what
Yep.
that can lead to preterm labor. So it's so important. You may be thinking, okay, but I'm drinking 8 glasses of water a day, when you actually
That's
may need 10, 12, 14. It really is very individual. And so if you're having a lot of these symptoms that we're talking about, would you agree like increasing the fluid is the best way to go?
Well, I absolutely agree. And actually, what I do for my patient is I ask them to do it by weight and activity. Okay, so this is Jane here. You see her?
Yes,
Okay. So
Jane.
Jane, Jane here. You see her spine, right?
Yes,
To the side, it's actually more curved than it should be. So this is when your back is super tight, and your kidneys are sit right here, right? Your
yes,
kidneys sit right here. You see that? It
yes,
could sit right here. And when these are super tight, you see um, this is where all the nerves come out, right?
yes.
Okay, that if they get pinched, you get all those shooting pains, numbness, tingling, all the jazz that you don't like.
Yes.
Well, what happens is when this gets super tight, these nerves also not only feed down to your legs and your intestines and stuff, these go to your kidneys
Mm,
and your bladder as
okay.
well. And this here, your sacrum, there's these parasympathetic nerves right down here that basically calm everything down. So you want to tip it backwards. If it's tipped like this, they're gonna because they're inside, right? Over here.
Yes.
They're inside over here. Whoa. Jane's like, what are you doing to me?
Careful with Jane over there.
So when they're inside, like here, right on here. So if your tail is tipped too much forward, it stretches them and overactivates them and makes you want to pee.
Gotcha.
So that's why you want to stretch out your back so it doesn't do that.
Ah, wow. I never knew that. That's awesome. So by stretching out your back, by opening up those joints, like you're saying, it actually
Mm-hmm.
reduces the compression on the nerves that make you have to go to the bathroom so often.
Mm-hmm.
Okay.
Yeah,
Interesting.
absolutely.
Interesting. Very, very good. That was a great demonstration.
Yeah.
Awesome. See, there's a reason we needed to do this in video. We needed to do this.
Absolutely.
We would have
Absolutely.
never got to see your little assistant there. All right, let's move on to another question, Dr. Ching. Okay.
Okay, no problem.
Okay, so great.
Thank you, Jane.
All right, so this one came in from, let's see, we answered a couple of these, so I'm going to move forward. This one came in from Shannon from Nebraska, and this is a little different than some of the other questions. She said she's on birth control, and her baby's now 3 months old, so this is a postpartum question. She knows that birth control can lower her sex drive, so how does she bump up her sex drive? I'm thinking to myself, she's got a 3-month-old, But yeah, postpartum in general.
Okay. Well, in general, do you know if she's breastfeeding or not?
I don't know, but I'm going to assume that that she is not if she's taking birth. Well, that's not true. She could be using birth control. I don't know. But let's talk about both, whether they're breastfeeding
Okay.
or not.
Well, usually with breastfeeding, right, you produce a lot more prolactin in your body, and that decreases your sex drive as well.
Yes,
Okay.
absolutely.
But, and of course, if you use the birth control pills, it'll also do that as well. And what you can do is eat things like very natural things, like oysters, like aphrodisiacs, like oysters and dark chocolate. That's a little treat for ourselves, but moderate it. And those are like very simple things that you can do. And I think most people don't realize that if you postpartum, you definitely need a lot more sun,
Yes,
okay,
yes.
to pick up the mood. And a lot of times women don't realize that because postpartum, we have a lot of depression that comes from not breathing because everything in our life is just like,
Mhm.
we feel like there's a really big burden because there's a baby we have to take care of, the whole family, right? And we feel so responsible, kind of like hunch a lot, right? And stress out.
Yeah, yeah.
And that really, uses up a lot of the resources in your body.
Mhm.
And getting enough zinc in your system, magnesium, as always, because those are actually things that help things in our body go round as well as many of the nutrients that we do have. And zinc, not only, as you know, helps you with your immune system, right? But it'll help you with your hair and also activate your DNA,
Yes, yes.
So what's zinc in? Most people ask, and they're like in oysters. And if you don't like oysters, there's always like wheat germs you could throw in your smoothies, right?
Yeah.
What's really nice is the sesame seeds, like the tahini, right? That you could put
Yes.
that as a dressing. So that's very easy to do, and that's really rich and nice, right? Like low fat roast beef even because you're going to need it anyway because it'll give you a good amount of iron, right? To supplement the blood that you lost.
Yeah.
So that's really good. Pumpkin seeds and squash seeds are normally really good, and also watermelon seeds, and they're high in magnesium already. Those seeds, and so that's really great. And peanuts, like just snack on some peanuts. These are all really good proteins, good carbohydrates as well. So it'll keep you fit and really great, and that'll help you rev up that sex drive. And what you want to do also is some experts say that they're the Kegel exercises, of course, right?
Yep.
And there's little gadgets out there that help you make the vaginal muscles stronger by having biofeedback, computer biofeedback, where it'll show you like there's these V shape. It's called a Gynaflex, right? And you
Okay.
put it in, and it's the thigh master for your vagina, basically.
The vagina thigh master. Very good. So
Yep.
a question came in from Tracy in Pennsylvania. Okay, and Tracy says that right now she's 12 weeks pregnant and she's had a
Okay.
horrible cough and cold. Very common,
Mm.
when you're pregnant, your immune system's down. And she said she went to her family doctor. He said that it's just a virus, but
Okay.
she's coughing so bad that she's actually hurting the ligaments in her stomach. And
Mm.
told her to take Mucinex, which hasn't helped the coughing at all. She wanted to know, is there anything natural that she could do for some relief? She's really suffering.
Well, definitely my number one thing is to get rid of the virus because even though when the virus is gone, you have a lot of the residual symptoms for some people up to like 5 to 6 weeks, and that residual coughing is just horrible. And
Yeah.
sometimes, what happens is that it goes up to our sinuses and we don't realize it. And
Yeah.
what's making us cough, right,
Yes.
is actually like the dripping from the sinuses that's tickling the throat,
Yeah,
right?
like a post nasal.
Yeah, that's postnasal. And, sometimes, as you relax at night, for instance, you'll know it's your sinuses because you'll start coughing in your sleep.
Yes. So you were saying about the post nasal drip could really be causing a lot of the coughing that occurs during the night. And so,
Yeah.
what would be some of the suggestions that you would have?
Well, it's something they actually mentioned before. Solutions is actually to lift, straighten up your posture, right?
Yes.
And also make sure these friends of ours are lifted,
Yes.
right?
Yes.
So you can breathe better, so
Yes.
you can clear out all the junk that is sitting at the bottom our lungs irritating it and making us cough because it wants to come out.
Yeah.
That's what's happening. So that's really good. And a really good exercise to open up this, because what happens a lot of times when we hunch over, the ribs and the clavicles get depressed. And so the clearing mechanism, it's basically a plumbing problem, right?
Yeah. Okay.
If this gets really tight and the neck gets really tight, this doesn't clear and this doesn't clear.
Gotcha.
Okay? The chest
Yeah.
doesn't clear. So what you need to do is open up, and after you just, a really good way to think about it. Beyonce has those really nice, what do you call these moves? These chicken wing moves?
Yeah. Yeah.
Right?
Yeah.
Those are really fabulous. Okay, this is a perfect time to do it.
Yes.
Just to help you open up, just to pump yourself up, and then you just pump yourself up this way, and then pulse it backwards.
Gotcha.
And this will start opening everything up. Not only will it relax those muscles, it'll help you build muscles, and it'll relax those back muscles that are really tight, and the chest muscles that are really tight. And then right after all that, you'll feel it start clearing a lot more, and the sinuses start clearing. And when that starts clearing, you know how they do when you go to the facial, right? When you get a facial, they do the massage around your face.
Yes.
Well, actually, it actually clears up and the sinuses by what you do is stimulate the nerves up here, right above, right here,
Yes.
where it's a little painful, right? Sometimes.
Yes.
Right, which means it gets a little stuck. Just basically rub it just like you remember during your facials, and under, right?
Yes.
And just down like this.
Yes.
And that'll start clearing, opening things up and clearing headaches and a lot of the tightness that's caused by all the coughing and the tightness.
Right.
Because when you cough, everything just kind of freezes up, right? So you want to open that up, and lots of water and vitamin C and zinc.
Dr. Ching, thank you so much once again. We're coming to the end here, and we really appreciate it.
Yeah, absolutely. I love being on here. I think it was a blast. Thank you so much.
We learned so much. Did everybody learn a lot? I know that I did, for sure. Okay, everybody, good night. It's the end of our show. Thank you so much again for visiting with us, My Baby Experts. Go home, kiss your babies.